Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and today I'm talking about ear tubes in adults. So kids need ear tubes often, but adults also end up needing ear tubes from time to time. The reason we need ear tubes and the reason kids and adults get fluid in their ears is because of the eustachian tubes not opening well enough. And I've done several videos on that. I've even talked about some newer techniques called eustachian tube balloon dilation. But the eustachian tube is this internal tube that has to open up to let air get into the eardrums. When that doesn't work well, you can either have a collapse of the eardrum where it kind of gets sucked down, or you can have effusions develop. We use the terminology a serous effusion, which means a very liquidy drainage under the eardrum, and we use the term a mucoid effusion, which just means a thicker a bit of fluid. And then sometimes people have a purulent effusion. That just means there's really pus under the eardrum, and that's when it's acutely infected, typically with bacteria. So for serous effusions or serous otitis media, and that just means, again, fluid under the eardrum, that can cause hearing loss, a muffled hearing, a sensation in the ears. And so when that fluid doesn't clear up on its own, so if you get an infection, it's not unusual to have some fluid that hangs around for a week or 2 or 3. But if the fluid's hanging around for more than a month, certainly more than 6 weeks, then usually you're going to be improved by having it drained either through a myringotomy. That just means making a little opening and sucking the fluid out and letting the hole close back off. In addition to placing a myringotomy, which can just drain the fluid, we can also place a tube. A tube's job is to hold a little hole in the eardrum open for about a year. Tubes fall out on their own and the eardrum closes back off. Well, how do we place tubes? In children, you have to put them asleep because they're going to be uncomfortable. They're not going to be able to sit still well enough for you to do the procedure. But in adults, it's really a fairly simple and not that uncomfortable procedure. I'm going to walk you through a video showing how that's done. Good. This is a little medicine's going to sting for a second, okay? This has got a chemical called phenol. We're just going to touch that to your eardrum. There we go. It's going to burn just a little bit. Turn that tissue white at the sun. Good job. Whatever. Suction off the excess phenol there. Loud noise, okay?
Uh-huh.
Tubes in, I'm going to do just a little bit more suction there.
Uh-huh.
Drops. I'm going to put some, these drops are going to be cold, they may sting a little bit, okay?
Uh-huh.
It's really something that can be done in the office, and it can make a drastic and immediate improvement in someone's hearing. Thank you.